What are my options to get rid of deep under eye creases, bags? I'm 25 and have always had deep creases, lines, bags under my eyes. I feel like it is just getting worse and makes me look older than I am. What are my options to get this fixed completely? Am I too young to get anything cosmetic done? Also, are there any creams to help?
Thank you for your question. You submitted a question with a single photo, and you state that you're 25 and that you've always had under-eye bags, deep creases, and lines, and you're looking for a way to address these issues, and you're asking about creams and other options. Well, I can certainly give you my perspective as a specialist. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I can tell you that I have dealt with a lot of patients with exactly this type of situation. And I'll share with you essentially what options I present at this current time. Helping people with under-eye bags is the most common procedure we perform in our practice. So to begin with, it is extremely common for a person like yourself to state they've always had these under-eye bags. In fact, people who come to me in their 30s and 40s will say that they've had under-eye bags since they were in their teens. And so the question occurs now is, what are the best ways to address this under-eye bag? Well, as of recent history, in the past several years, the options have become essentially to do something that is a filler versus doing something surgical. And I perform both in my practice. And certainly just to deal with what is considered and perceived as less invasive, although fillers, basically you're going through the skin, it's in my mind no different than doing surgery. But in terms of the placement of fillers, fillers can be effective and help to soften the transition between the deep area of the tear trough relative to the under-eye bag. And speaking of the bag, it's important to understand what the anatomy here is so you can understand the principles of the solutions. The under-eye bag represents something called lower eyelid fat prolapse. Lower eyelid fat prolapse is essentially the movement or shifting of fat that's under the eyes forward. Now, of course, this is something you've always had, so it's not an age-related thing, it's just an anatomic thing. The solutions in front of you are basically ways to either soften the appearance or to surgically reduce the fat pockets. So when it comes to the question of age, and at 25 you may feel you're too young to have this procedure, well, the reality is that there are plenty of patients I have operated on in my practice who are your age and younger. And essentially, the problem has to do with, or actually, you pursue the solution when you have the problem, and the problem is significant enough to do some kind of intervention. So in my mind, for a 25-year-old, it is less practical in terms of this time of your life to keep going to a doctor's office to keep getting injectables if you can have an alternative that may provide you a more long-term, more definitive solution. So based on just the photo and not a physical examination, I would lean towards having you undergo a procedure called transconjunctival blepharoplasty. Now what that means is, under local anesthesia with light sedation, I would address the fat pockets from the inside of the eyelids. That means reducing, resecting, or removal, as well as repositioning as is appropriate, so that you look as if you never had the under-eye bags. This procedure works very well. It's essentially a procedure that can last a very long time, particularly when you do it this young in your life. And it will more definitively deal with the anatomy of your issue. Now, something as a side note, a lot of times when people have this type of issue, they also happen to have relative hollowing of the cheek area. and and it's something that I point out, and it's not hollowing in terms of aging, but more of hollowing just as a matter of anatomy. And so I also discuss the options of augmentation of these areas, but it does bring us back to considering fillers and other things. A lot of times with the lower eyelid blepharoplasty, I will combine that with PRP to help improve skin quality and in discolorations, and maybe help improve some volume in this area. PRP is platelet-rich plasma. It's derived from your own blood, and it's routine for us to do this at the same time as the procedure to maximize the aesthetic outcome, because we're now improving, we're taking away the fat pockets, but we're also improving skin quality. A lot of times it's important, what I suggest to my patients is do the procedure, see how you look afterwards. If anything draws your attention, then we can always consider procedures that might help further maximize your appearance. But I think based on this photo, I would probably lean towards lower eyelid blepharoplasty. Again, in our practice, we perform these procedures in a Joint Commission certified facility, which is the same certifying body that certifies hospitals and surgery centers. So we're able to provide the safety and the standards of quality, but at the same time do everything in the office setting under, and again, local anesthesia with light sedation. So I think it's important for you to meet with qualified, experienced cosmetic surgeons, look at their results, look at the level of experience with doing this type of procedure, see if you like the outcomes, and I think you're more likely to get what you want more definitively with that approach. Again, a physical exam is very important to really make a more definitive recommendation. So I hope that was helpful. I wish you the best of luck. Thank you for your question.